Crista had spent 14 months in the NICU at one of the local hospitals here in Omaha, and had numerous central line infections because her gut was so full of bacteria that it kept feeding into her central line. And after 14 months, they were kind of at their wits' end and couldn't quite decide what to do. And when I took Crista, I asked that she come to the Med Center to get involved with the IRP team. I'd been involved with the IRP team at that point for about a year with a couple other children that I had. And as soon as Crista got here, she had a step procedure, and basically in the year and a half that I've had her, she's only had 5 central line infections versus 1 a month, you know, so we beat it by a significant amount. Crista is acting and moving and playing like a typical 3-year-old. Our biggest issue now with Crista is that, you know, we start feeding our kids as early as 6 weeks old. Crista's 3 years old and just beginning to eat because she was so sick, and quite honestly, by the time we got her to the Med Center IRP program, you know, she was already almost 2 years old. And so we need to get these kids in sooner to the IRP team. Feeding is a huge issue for these children. If we can start feeding them at 6 months, once they're in the IRP team, because they want them to start eating right away. The sooner we get them to eat, the sooner we can get them off the feeding tubes. And so that's our biggest struggle with Crista now, is just the feeding. She's in a feeding program, and she's getting there, but it's going to be a long process. It's just that her comfort level was laying in a crib at 1 year and 4 months old. Yeah. So you look at her now, and she plays outside. She doesn't want to come in at night when it's time to come in. She wants to ride her bikes, you know, and that's what life should be for these kids, because there are a lot of ups and downs. The IRP team knows exactly what they're doing. They have the expertise to say, let's try this. If that doesn't work, then they're willing to go on and try other things. Crista, when I first got her, was 1 year and 4 months old. She could sit up, she couldn't crawl, stand, walk, anything. She was so physically disabled that getting her on the right track and getting rid of all those central line infections, getting the step procedure so her bowel started working, has made a huge improvement in her life. I would recommend this program to anybody that's got a child with short gut, even in the process of being listed on the transplant team. There are so many things that the IRP team can do. You have a social worker, you have a dietitian, a nurse coordinator. The physicians treat these children like they're theirs. Dr. Mercer will get on the floor with Crista and play with Crista, or any of the children. There aren't too many other places that you go to that our children are treated like children and not just their disabilities, you know, or another patient or another number. I'd had experience with the transplant team, so I knew some of the physicians and the nurse coordinators, but I've seen them with new parents, brand new parents coming in and being frightened and coming in for their evaluation, and within a few days they're right at home here, and they feel, the Med Center and the IRP team make them feel when they come from out of state that this is their home. They have the nursing staff train you, the nurse coordinator spends time with you, family members can come, they'll train them. And again, it's a process of not shaming you into, you should know this, this is your child, you have to do this, you have to be comfortable with it. Because people aren't comfortable flushing a central line or putting in a G-tube. You know, that's not the normal comfort level for most parents. And so they get you to the point where you feel comfortable. And then there's a home health care agency that will come out to your house every day of the week that you have that child home if you need their support. So there's a whole team here, the physicians, the nurses, the coordinators, social work, the dietitian, and the home health care agency. It's all a group effort. And it's, you know, you don't go home with that child until you have a comfort level with taking them home. If you get home and it's midnight and the tube won't work or the pump's beeping, which it's going to happen. It's going to happen to every parent. You've got lots of resources, and they'll come out to your home if you need that kind of help. You have their pager numbers, you have their phone numbers. They're on call 24 hours a day, 7 days a week. They don't talk down to you. No question is a dumb question. You're going to be told that a million times. even though they probably heard that same question a million times, they make you feel like it's the most important question of the day, you know, so you feel comfortable in asking them even the silliest questions. You know, I know I really feel silly asking this question, but they make you feel that you and your patient are the most important people in the world, even though they've got a waiting room in a hospital full of other children. I couldn't ask for a better program. I just couldn't.
You have a kiss from us.
I love you so much, my princess.